And as the wildfires spread, air quality continues to be a concern. For more on this, we've reached Rebecca Saari. She is Canada Research Chair in Global Change, Atmosphere and Health. She's also an Associate Professor at Waterloo University, and she joins us from Waterloo, Ontario this morning. Thanks so much for taking the time to talk to us today.
Morning, Marianne.
You know, if we weren't aware that there were actual air quality alerts in parts of the country, just looking outside, particularly even here in southern Ontario, you could really see that haze there from these wildfires. And we know yesterday, Toronto, Montreal recorded some of the worst air quality levels, not only here in the country, but in the world. And that's specifically because of the smoke from the wildfires. So let's start with the concern here. What do you think when you hear about that?
Absolutely, it's a concern. It shows to me the effect that wildfires can have in reducing some of the progress we've made in cleaning air here in Canada. I see almost coast to coast, we're under an air quality warning or statement. And that means people need to take steps to protect themselves, or they could experience symptoms, some of them acute.
Let's talk more about the symptoms. What are we talking here? That's
right. Well, when air pollution levels are as high as they, as you've mentioned, right, when we're under these warnings and statements, anyone in the general population can experience symptoms like irritation of the eyes, nose, throat, headaches, cough. But we can see more severe outcomes for especially sensitive populations, which are normally the elderly, children, and people with underlying health conditions, so heart and lung problems that could send them to see their doctor or the emergency room.
Wildfire smoke is not just regular smoke. Looking at the images from even the prairies, for instance, seeing how much is being devastated and consumed by the fire, can you explain to us what are some of the possible dangerous toxins that could be burning up in those fires that are now entering the air and possibly our systems?
Well, that's an interesting question. So, wildfire smoke, there's emerging evidence about, whether its effects are different than, as you were mentioning, other forms of smoke or particulate. For me, the real concern with wildfire smoke is that it's the major source of one air pollutant called particulate matter that is associated with over 17,000 early deaths every year in Canada and around $150 billion in economic damages. And these fires are acute events, but they contribute to our long-term exposure that leads to this health burden.
So how do we protect ourselves? I know this is obviously not the first time Canada has dealt with wildfires and, of course, the poor air quality that comes with them. N95 masks were part of the conversation, especially coming out of the pandemic. We were more aware of what those masks can do as far as filtering out particles. Is that the best way to protect ourselves? What do we do right now?
The best thing everyone can do is make a daily habit of checking their air quality health index and following the associated guidance. And yes, when it comes to wildfire smoke in particular, N95 masks, if they're well made and well worn and well fitting, then they can reduce risk. However, for the most part, the guidance is actually to limit time outside, especially doing really high physical exertion like exercise, and to move those activities to places and times where the air is cleaner. And while you're inside, keep doors and windows closed as much as you can, though if necessary, prioritize keeping cool. And if you have an HVAC system with a filter, run that. If you have a portable air cleaner, run that. If you absolutely must go outside, then yes, using those masks will offer some protection.
We have about 30 seconds left. You mentioned go outside when the air is generally cleaner. Is there a particular time of day when that usually happens, or does it depend on how the wind's blowing that particular day?
With the number of wildfires that are burning right now and where they are, it's really going to depend on where the winds are blowing. However, we do have air quality health index forecasts that cover, day, night, and the next day for 3 days. So you can check and you can plan a little bit. The AQHI is based on a 3-hour concentration, and you can also check, your local particulate matter levels if helpful. But it's more of a planning in chunks rather than moment to moment. These situations can change quickly, so it's best to stay informed.
Rebecca Saari, thank you so much for your time, your insight, and your advice this morning. Canada Research Chair in Global Change, Atmosphere and Health.